Pharmacies all over Russia have run out of Uramitexan medicine produced by the American company Baxter. It is used in the treatment of cancer patients and autoimmune disease. The promised import substitution did not work either. It is currently impossible to find any Russian analog in pharmacies.
The last time information on Uramitexan was entered into the automated information system of Federal Service for Surveillance in Healthcare was in April 2023. A total of 6,900 packs of Uramitexan were imported into Russia last year. This is 8 times less than in 2022 and almost 7 times less than in 2021. The cost of its production is rising due to inflation and expensive logistics, and Baxter cannot promptly raise the price of Uramitexan in Russia, as the drug is included in the list of vital and essential drugs and its cost is regulated by the state. From publication in The Insider.
The lives of Russians with diabetes are also at risk. State purchases of the fast-acting insulin from January to March 2024 decreased by 70% compared to the same period in 2023. In several major cities of the Federation, another vital drug, dicitenon, has disappeared. It is used both in tablets for the prevention and treatment of capillary bleeding and in the form of solution for injections during surgeries. Doctors in several regions of the country are complaining about the shortage of medicine for seriously ill children. On condition of anonymity, they say that they have appealed to the prosecutor's office and the investigative committee, but the situation has not changed.
The situation with medicines for disabled children is terrible. If a year ago the provision was barely up to 50%, then with the onset of the new year there are no medicines at all. If you go to a pharmacy, they blame the Ministry of Health. If you go to the Ministry of Health, they blame the regional authorities. And as a result, there are no purchases and no medicines. Why are the disabled children are left without medicines at all? An employee of a Russian medical institution on condition of anonymity in a comment to Sibir Reali.
The public movement Patient Control claims that there is a shortage of medicine for patients with HIV. The activist appealed to the Ministry of Health. Participants of the movement claim that part of the auctions for the purchase of necessary drugs between the ministry and the suppliers have not taken place. According to Patient Control, manufacturers do not submit bids because the Ministry of Health underestimated prices.
A decree of the President of Russia declared 2024 the year of the family, and it seems logical that special attention should be paid to families with many children. But no, a mother of 5 children from the Sverdlovsk region came to us. She had already changed her regimen several times. During pregnancy, the patient had been taking raltegravir. However, after delivery, the drug was replaced, citing a shortage. Unfortunately, this substitution was not suitable. The girl asked for a replacement and was given other drugs, as a result of which her cholesterol went up and she now has to deal with gastrointestinal illnesses. From a post in Interruptions.ru. In the next 10 years, all foreign pharmaceutical companies will stop their development in Russia. Russian patients will not receive 300 new drugs that will probably be developed over the next 10 years. Naturally, this will be the most modern, the newest, most effective drugs, but they will probably not be on the Russian market.
More than half of Russian doctors surveyed also complained about problems with medical equipment. Most often, Russian hospitals lack CT, MRI, ventilator and ultrasound machines and spare parts for them. According to the doctors of the Russian Federation community, 64% of doctors are sure that the Western sanctions imposed on the state after the start of full-scale war against Ukraine are to blame. Reported by Anastasia Tarnavska, Larisa Zubenko, UATV News.